Asthma is a common lung condition that causes breathing difficulty. Also, it causes cough. So, there is increased responsiveness of the airways, the lung pipes, which causes narrowing of the airways and reduced air inside a person's body. So, that there is breathlessness and cough, and it can cause a variety of symptoms. So, it is a quite a common condition which occurs in individuals. Asthma is often categorized into different types. The types are: one is allergic asthma, you have brittle asthma, then there is aspirin induced asthma, steroid induced asthma, asthma COPD overlap, which is also another condition. Exercise induced asthma, certain people get asthma after doing exercises. And also, there is a special asthma in elderly. So, in elderly patients, they develop the asthma in adulthood. So, it's known as asthma in elderly. Asthma harbors a special type of inflammation. So, in a predisposed individual, the airways become hyper-responsive to a wide range of triggers. There are certain triggers which induce asthma. So, when there is hyper-responsiveness to these triggers, there is narrowing of the airways, there is narrowing of the lung pipes, and it causes to reduced airflow into the body, into the lungs, and which causes breathlessness, wheezing. Also, there is increased secretion of mucus, which leads to coughing and mucus production, sputum production. So, a predisposed individual and exposure to the triggers leads to asthma. Also, stress is an important contributor. So, there are certain triggers and contributors which lead to development of asthma in an individual. Symptoms of asthma are wheezing, coughing, shortness of breath, that is breathlessness, chest pain, chest tightness. So, commonly the patient presents with complaints of breathlessness, cough, which is there since some days, and they feel like they are not able to breathe. And chest pain and chest tightness is also a very common symptom, which sometimes may need hospitalization, sometimes which can be managed at the OPD levels. Asthma attack can be life threatening when there is severe breathlessness leading to respiratory failure. So, when there is complete, that the airflow is reduced to such low levels that the patient oxygen levels drops and it causes a respiratory failure. So, there is air hunger, like some patients get severe breathlessness, then it can be life threatening. Some may require mechanical ventilation also in extreme severe cases, and some emergency medicines may also be required. Inhalers are an important part of treatment in asthmatics. So they are inhalers contain the medication, and so how to use, which is a very common question the patients ask. So you have an inhaler. First, you have to take out the mouthpiece of the inhaler, shake the inhaler well for 5 to 10 seconds before each use. You keep the mouthpiece between your teeth and close your lips around it. Breathe in slowly and take a deep breath and push on the inhalers. So once the medication goes inside, you keep it inside for 10 to 15 seconds and then remove the inhaler and gradually breathe out. So, so this causes, after that, you have to gargle your mouth, rinse your mouth with water so that the medication does not stay inside the mouth. So, using inhaler correctly is very important so that maximum effect of the inhalers can be seen in the patient. So, the patient feels better and recovers faster. There are a lot of myths with the inhalers. So patients generally do not accept the inhalers so easily. One is they feel that they'll get addicted to the inhalers. Another is they feel that it is dangerous. They have dangerous side effects. The inhalers will harm their body more than they'll benefit them. Another is they feel the inhalers. Are strong and should be used only in severe conditions. Only severe asthmatics should use it. Another myth is that only children with asthma will benefit from inhalers. So these are all the myths which are there, and proper counseling to the patient is very important so that they understand the benefits of the inhalers and the medications. If one is taking care of an asthma patient, one has to make sure that the patient avoids dust, allergens, animal fur, pollen. Another is they should have a healthy diet, have adequate water. They should keep their inhalers handy. So whenever necessary, whenever an attack of asthma patient develops, the inhalers should be handy. If they are traveling, they should carry the inhalers. And having an overall, healthy lifestyle, they should learn to manage stress and avoid the triggers, avoid the allergens which are generally precipitating. Also, viral infections. So, avoiding viral infections by getting vaccinations, flu shots every year, that will prevent them from getting repeated respiratory infections. Depends on the symptoms and the duration of symptoms. Inhalers are given medications like beta 2 agonist, salbutamol, formoterol, salmeterol. They are for the acute asthma and for the preventing disease progression, also the longer duration, longer acting beta 2 agonist. Inhaled corticosteroids are also used. They help in disease progression, preventing disease progression. Apart from that, you have certain medications, anti-leukotrienes, like you have montelukast, which are also help in asthma, for the progression of the asthma and help in relieving symptoms. Along with that, in severe cases, you have systemic corticosteroids, oxygen supplementation in severe cases. In certain patients may need mechanical ventilation or types. There are various types of mechanical ventilation modes which can be used in them. Nebulized beta 2 agonist and anticholinergics like ipratropium. So they are used in hospitalized patients or some patients who are long term asthmatics. They can use the nebulizer at home also in moderate to severe cases. They have to follow certain measures. They have to avoid dust, allergens. Most of them identify when they get an attack, they identify the allergens, so they have to avoid that. Along with that, they have to keep their inhalers with them when they are traveling, especially, or even when they are in their house. It has to be handy. Another thing is they have to eat healthy food, avoid cold air exposure, avoid cold foods and beverages. Apart from that, as I told, getting a vaccine, the influenza vaccines every year, the flu shots, so which help them to catch infections. Wear a mask when there is an outbreak of any respiratory disease. They need to wear a mask. Protect themselves from catching infections, and also managing stress. Managing stress is also very important, as it also triggers, it also contributes in the attack of asthma. So all these things, having a healthy lifestyle, managing their disease, it will help them by following all these precautions.